If you're worried that your child is struggling with everyday things such as communicating, dressing, eating, self-care, support is definitely out there in the form of occupational therapy. Let me talk you through how to get it here in the UK. Hello, I'm Ed, father to Finn, who has significant special needs. This channel covers our journey and provides a parent's perspective on caring for someone with disabilities. So if we quickly talk about how occupational health, or OT, helps us. Currently, Finn has a physio who visits him for treatment at school. We're also guided on exercises for home, which are really useful. He has scoliosis and tightness behind his knees, which really impact his mobility. He's also managed to get a wheelchair through OT. That was a referral through occupational therapy at school. And for medium and long distances or where there's uneven ground, it's absolutely perfect for him. Changing and bathing Finn has also become increasingly challenging. He's grown obviously older and considerably larger. He's not much shorter than I am. So to help, again through occupational therapy, we've managed to obtain a special bed, and also we've got an inflatable bath contraption that gets Finn in and out of the bath. We'll do a video on those showing them in a bit more detail shortly. So you might be thinking, okay, I'm interested in OT, but how can I access it? Well, there's a few options available. The first option is to speak to your GP. They can refer your child to NHS occupational therapy services. Often that's through a local community health team. It all starts with a really simple conversation. You just explain your situation, what you've noticed, how you think they can help, and don't be afraid to be too specific. Another route is through your child's school or perhaps nursery. Teachers, Senkos are trained to spot when a child may need extra support. So if they think that occupational therapy could help, they can make a referral to the local authority or bring in a therapist directly, depending on what's available in your area. Home occupational therapy is also accessed, and that can be accessed through a care worker, and that's the way that we obtained it for Finn. So how does the actual process work? Once your child's been referred, they usually go through an assessment with an occupational therapist. It's not scary, and it's something we've been through, obviously. The therapist will look at things such as fine motor skills, coordination, sensory needs, how your child copes with daily routines or doesn't cope, and a multitude of other items. If your child has ongoing or complex needs, you might hear about something called an EHCP, an Educational Health and Care Plan. It's referred to in some of the other videos that we've done, but essentially it's a legal document that can include occupational therapy as part of your child's education support. And you can request an assessment for this through your local council. After the initial appointment, the OT should have gathered more information about how your child is managing or perhaps finding challenging everyday tasks. They'll also have found out what the priorities are from either you as the parent caregiver or the young person themselves. And really these goals will help shape any future appointments that may be offered. If appropriate, the OT may contact your child's school to discuss how things are going and if they have any concerns. I know the process might sound a little overwhelming at first, but don't worry, you're not alone. Speak to your GP or your child's school and really just take that first step. The right support can make all the difference, not just to the child, but to you as parents and carers. So let us know your views on this topic within the comments. Have you accessed OT? How did you get on? Was it challenging? Was it straightforward? Could it help your situation? Please share any learnings that you have within the comments of this video. Please continue to like and support this channel. Most importantly, kindly share this video with someone who you feel it might be appropriate with. Help us get our content further afield. Thanks very much. Cheers.